technologies that are on the market today. Folds are common among seniors, are actually a major reason for institutionalization. And we've come a long way from the dependent, the advert, I've fallen and I cannot get up. Now we have a number of products on the market that have the automatic or the auto detection functionality. This is the auto alert pendant from Philips Lifeline. This is an accelerometer-based prototype from the Technical University in Zurich. And those systems integrate either a gyroscope or an accelerometer. Some of them also integrate a tilt sensor, like this one here from Tunstall, to determine whether a person has fallen based on the acceleration, deceleration profile, the impact, as well as the orientation of the body to alert a carrier. This is also a chest strap fall detector that has, in addition to the accelerometer, it has a built-in EKG, so it can measure heart rate and breathing rate, skin temperature, as well as measure overall activity, whether the person is physically active or not. Similarly, this is another device from Wellcore. That one is from a company called Halo Monitoring. So these all deal with primarily fall detection, but the issue is more, we need to intervene before a fall happens. So what these do is shorten the response time and improve the survival prospect for the individual and reduce the injury post a fall. This is a patch, a wireless patch that alerts caregivers if a fall risk individual attempts to leave a chair or a bed. I'm not a big fan of these types of fall prevention technologies because they are, in my opinion, they're electronic restraints, and I prefer to encourage physical exercise and movement to prevent falls. Another application that is not here is the use of electronic health records and the review of medications to prevent identify potential contraindicating medications and prevent falls. There was a study that showed the promise of using electronic health records for that application. Another area of concern is wandering and for older adults with cognitive decline, and we're starting to see a lot of we saw a lot of tracking devices. Some of these use GPS, some of these use cellular signals, some of them use RF tracking, and the main problem with those is being rejected by the older adults and non-compliance by the users. And we're starting to see some companies embed these technologies into everyday apparel, like the shoes here. As I said, all of these wearable devices are subject to non-compliance, whether it's intentional non-compliance, rejection of the technology for perception of stigmatization, or non-intentional non-compliance due to forgetfulness or due to circumstances. For example, 76% of falls that happen in the community happen in the bedroom-bathroom area, and mostly during the night when it's least likely for the person to be wearing their pendants, right? So to overcome these issues, we're starting to see technologies that use sensors embedded in the environment, or passive monitoring technologies that use a number of sensing modalities. For example, this system here from Grand Pier uses security-like motion sensors and detects lack of motion, lack of anticipated motion. For example, if someone got up in the middle of the night, went to the bathroom, and they were in the bathroom for more than 20 minutes and there was no motion anywhere in the apartment, that indicates that it's likely that they have fallen, that they're incapacitated on the floor. So the system sends an alert to a caregiver or a nurse. They can call the individual, and if there is no answer, they can dispatch a caregiver or emergency services if needed. Another technology is this device here called Cook Stop, which is aimed at forgetfulness, turning the stove on and forgetting the stove, as we've seen in the video. This device uses a motion sensor and a timer. It has a programmable timer, and it basically, if the person left the stove unattended for a predetermined period of time, it shuts off the electricity to electric range. There are versions of this that work also with gas stoves or gas ranges. This is a technology that we've worked on at the University of Virginia. It's a fall detector. It's a passive fall detector. It uses piezoelectric sensing modality. It monitors floor vibrations, and it's capable of discerning a human-like body falling and causing a certain signature of vibrations from dropping an object on the floor. So when a human-like body falls, when we fall, we hit the knee, the hip, the elbow, the shoulder, and then the skull. So we have a series of impacts on the floor within a short period of time, and that's what this device looks to. And we've tested that in laboratory setting using anthropometric dummies and crash test dummies. And the detection rate was, the sensitivity and the specificity was 100%. So I don't know how that's going to translate into a real life setting, but it shows the potential of the technology. Another issue is monitoring well-being, how the person is up and about and how well they're doing, how physically active they are. And there are several technologies, as I mentioned. This is the halo monitoring, the chest strap. There are armbands that measure not only physical exercise, but also compute energy expenditure. And these have been shown to be effective in weight management interventions, especially when coupled with diet and as well as exercise. There are different cardiac monitors, patches that can be worn on the chest that communicate with a cell phone and monitor heart rates for abnormalities or arrhythmias, and can alert the cardiologist immediately. There are ambulatory blood pressure monitors and so on and so forth. So these are, again, wearable, and there are other devices that are embedded in the environment. We can use motion sensors to evaluate overall activity profiles and detect deviations in those profiles as indicators of early onset of disease. This is a bed monitor. It also uses a foam-filled pad. This is a foam-filled pad, pneumatically connected or connected via air tubing to a system, and it's capable of measuring heart rate, breathing rate, just by a person lying on a mattress on top of this pad. It also measures time in bed and time out of bed and restlessness during the night. So it's capable of evaluating sleep quality throughout the night. And if you couple this, the restlessness, with nighttime activity, for example, bathroom trips from motion sensors, we were able to identify urinary tract infections in the very early stages. And in a pilot, in an assisted living facility, we demonstrated that this type of system reduced the billable interventions, hospital visits, ER visits, physician visits, lab tests, and so on, by 75% over a period of 3 months compared to a control group through primarily detecting frequent urinary tract infections early and alerting nurses